Pain at the front of the knee, just underneath or around the kneecap, is extremely common, and in many cases there's a really quick, simple solution. So in this video I'm going to show you the quick fix and then some other solutions in case your knee pain is a little bit more chronic or severe. The kneecap slides up and down in a groove at the front of your knee, and the groove acts like a train track, keeping the kneecap in place. But if the muscles each side of your thigh get out of balance, the kneecap can move to one side and start to grind, and this will cause pain underneath the kneecap. And runners, cyclists, hikers, and gym junkies who do a lot of squats tend to get this. The most common direction of kneecap grinding is on the outside of the groove. The kneecap moves out too far. So this can be caused from muscles that are too tight on the outside of the thigh or muscles that are too weak on the inner thigh. And this brings us to the quick fix. Overdoing sports that work the quads a lot can cause the outer quad muscle, the vastus lateralis, to become tight, or adhesions to develop under the iliotibial band. It's easy to both test and release this side. Sitting on a low chair with your knee straight, roll your leg in a bit, relax the thigh muscles until the kneecap goes floppy, and then rub the bottom third or half of the outer thigh with the heel of your hand. If this is sharply painful, this is the most likely cause of your knee pain. You should be able to push quite hard and have no pain in those muscles. To release the muscle on this side, simply rub in small circles with the heel of your hand right down to the side of the knee. For some people this can be excruciating, so if it's a bit too sore, just start off by rubbing with your fingertips instead. It usually helps to have pants or tracksuit pants on for this. Do this for a minute or two, a couple of times a day. This technique can stop the knee pain really quickly, sometimes within a day, sometimes within a week. Keep doing this daily until you can rub that area and not feel pain. A lot of people recommend a foam roller for releasing this area, but foam rolling on the side of the thigh is awkward, and with this rubbing technique you have much more control. After the muscle release, we need to stretch the outside of the thigh. Holding the back of a chair, grab the foot of the painful side with your other hand and pull it up and then in. We don't want to pull the kneecap into the knee too much and inflame it more, so don't bend your knee back as far as you can. Just bring it back a little bit instead. If it hurts your kneecap, either stop or do it gentler. We want you to feel this in the quad and hopefully more on the outside. You can use a towel around your foot if you struggle to reach your foot. Hold for 20 to 30 seconds, twice, once a day, and after exercise that works the quads. If the pain at the front of your knee is chronic or unresponsive to this lateral muscle release, we need to look at three other possibilities. So what other things can disrupt the tracking of the kneecap and cause it to grind against the bone underneath? 1. If you've got flat feet, your knee will drop in, causing the kneecap to rub against the side of its groove. So if that's the case, you may need orthotics and/or pronation support trainers. 2. In some people, instead of too much tension in the muscles on the outer thigh, there's a weakness of the inner quad muscle, the vastus medialis. This allows the kneecap to track out too far to the outside. The inner quad muscle is most active in the last 30 degrees or so of extension, so we can strengthen it in this way. With a foam roller or rolled up towel underneath your knee, externally rotate the leg to about 45 degrees and then slowly extend the knee. Hold for a few seconds so that you can see the vastus medialis bulge and then lower it again. Repeat 10 times and do 3 sets. You can do the equivalent on a chair or a bench. And if you don't seem to be feeling much of a burn in the vastus medialis, you can add a slight weight. Our old friend glute medius is the last common cause of kneecap pain because its effect on abducting internally and externally rotating the hip has a large influence on the way the knee sits. Now I prefer a closed chain method of strengthening it, which is quick and simple. Stand on one leg on the side of your sore knee. Then allow your hip to drop out to the side under the weight of your body. Then contract the muscles on that side of the pelvis, not the other side, until the pelvis is tilted the other way. And repeat that several times slowly until you feel a burn in the muscles here. Work your way up to 2 sets of 10 over a few weeks, but don't do too many on the first day. Glute strength varies enormously, and some people will get sore the next day after only doing 5 or 10, so don't do any more than that on day 1. Now obviously if your knee pain is pretty bad, you might need to ease up on sport until things settle down. And if it's really inflamed, it's a good idea to ice it 3 times a day for 10 minutes, and that'll reduce the inflammation, just to start things off. But that's it for today. Hope you liked the video. If you did, please consider liking, commenting and subscribing to support the channel, because it really helps. Okay, cheers. Now obviously if your kneecap... Our old friend... No.